Hello and welcome to Street Psychology Podcast. Today's guest is Dr. Keisha Downey. She's a licensed clinical psychologist, a licensed marriage and family therapist, and she's known for her impact in working as a therapist on several popular TV reality shows. Welcome, Dr. Downey.
Thank you for having me. Super excited.
Today, I wanted to talk with you about the parent-child relationship.
All right.
Okay. That's a good one?
Yes, it is definitely a good one.
What makes you say that?
Because I have children of my own. They are adults. I am a grandma, and I deal with a lot of patients who have parent-child challenges, issues, trained in it as well.
Yeah. I feel like a lot of people get some good value out of it. So the first question I have is, what made you want to work in that field of psychology to include parent-child relationships?
How did I even get into this? I was one of those individuals that people would come to with their problems and how to figure things out. I feel like I just took that on and did something with it later on in life. I was supposed to be an attorney. I'm actually glad I went this route. I'm in the helping field and I see a lot of growth within individuals. It makes me feel so good when I see that. So that's how I know this is my true calling. I've been doing this for 21 years now. With the parenting piece, having children of your own and making mistakes helps you want to do better or teach other people how to not repeat the same mistakes that I may have had or made. So that's how I got into it. And then working with parents and helping them to see how they can improve and seeing the growth or the fruits of that, it makes me feel good as well.
Yeah.
Do you have children?
I don't have children.
Okay.
Yeah, I hear a lot about it because I have two younger sisters with children.
Okay.
So right now I have the 5 nieces and nephews from them. And so I just imagine
You're
the
like,
daily.
got it. Yeah.
Yeah, I know it's not easy. And I know every child is different. And every relationship is different. So what are some of the key elements that you find important that's indicative of a strong parent-child relationship?
A strong parent-child relationship, when a child can come to their parent and tell them anything, you can tell by the interactions how the mother or father talks to their child or greets their child. There's so many different factors to show it. But more importantly, just like one of the things that stands out is when a child feels comfortable enough to tell their parent everything. A parent has provided a space for the child to come to them and speak on whatever and not make them feel bad for doing so.
So having that non-judgmental, unconditional, supportive environment.
Mm-hmm. Yep.
Yeah.
Exactly.
So for parents who might not be as good at providing that space, it's a learning process.
Yes, it is.
So what about those parents who want to be approachable, but also keep that authoritative approach?
That one's a little harder because a parent has to recognize that they are not approachable. They understand they have a authoritarian parenting style. To me, that would mean they want to make some changes, right? They want to do what they need to do to shift the dynamic of the relationship. It really does fall on the parent. We have to take the lead in it. If they are ready, we can teach them how to take the steps to open up that space for the relationship to build. When you have a parent that's in denial or feels that they're not doing anything wrong, those cases are harder.
So it's the readiness to change and that awareness that the parent needs.
Yes.
Before.
Yes. It's tricky because there's a handful of, or more than a handful of children that are born accidentally or we weren't expecting this. And then there is a lot of couples or individuals who plan to have children. When the child is here, they have their own little personalities. And so we have to figure out how to best mold those individuals into the best versions of themselves. Parenting is one of the most difficult jobs because you're in charge of helping to mold a human being, like their brain, into something. And we want the best for our children.
Yeah, one of the hardest jobs ever.
One of the hardest jobs ever. I can attest to it.
Yeah.
Yeah.
Yeah. So do you have multiple children?
I have a son and a daughter. They are adults. I am a grandmother of a 4-year-old.
So you even have the grandparenting part in there, that experience too.
Where you just want to, I know everything. I could tell y'all what to do, what not to do, but then you got to let the parents learn on their own and stuff. But I definitely am in the background guiding as best as I can.
Is that what you recommend from a grandparent, more of a guiding role rather than assuming the role of parent?
Absolutely, because
Okay.
you don't want to cause a rift between the couple, the mother and the father, if you have a parent or a grandparent that's doing too much. The parents have to figure it out on their own. Grandparents have to know their places. In certain instances, grandparents have to step in all the way if there's an absent parent. But yeah, grandparents need to know their roles big time.
So, what are some signs that would say that a child doesn't feel emotionally safe?
Withdrawal, isolation, acting out, anxiety,
Mm.
sadness, depression. There are a lot of different signs that can indicate that there's not a safe environment in the home for the child to connect with the parent, or they're seeking out that type of care from other things, right? Whether it be drugs, whether it be gangs, whether it be promiscuous behavior, the list goes on. That's why it's really important for parents to make sure they provide the groundwork, the foundation, give the child everything that they need to succeed in life so that they can be the best versions of themselves.
Yeah, so it could come out with, like you said, isolation and depression and things like that.
Mhm.
It's hard to say whether that's from the environment or could that be external, or is it going to be pretty clear that it's pretty much saying that the child doesn't feel safe and comfortable in their home with parents?
When I say safe, meaning they don't have a safe space, they're not comfortable opening up about their feelings, right? And it's not that a parent is necessarily abusing the child. The parent may just not have made them feel comfortable. It's
Mhm.
always about something else. They don't have time. They're always working. We are setting the stage, planting the seed on how things should be. Remember, we set the example. You have to say, hey, come talk to me. If you need anything, I'm here to help you. Showing them things, whatever, that's creating that space. But if the parent is absent, never there, could be out working 2, 3 jobs. It doesn't mean that the parent is making it physically unsafe. It's just that child may not have or know that they have that outlet to come to the parent. And they might feel like, oh, I don't even want to bother my mom or my dad because they're super busy. I don't want to lay it on them. So then they find other ways. And yes, external factors do play a role in feeling safe as well.
Okay. So, how does the way that parents communicate with their children influence the child's self esteem and confidence level?
Talking down to a child, not praising them, focusing on the negatives. So, you have children, little children, that they're supposed to not sit still, or they're supposed to be toddlers and move around and do different things. If you're constantly chastising or picking at a child about the things that they're doing wrong, it can create a sense of angst or a sense of critiquing, criticism in a child. And that's too early to do that, right? We want to make sure there's a balance. We can discipline a child or guide them when they do things that could be considered a weakness or areas that need improvements, but we also want to praise the child when they do the good things or the right things, if that makes sense.
Absolutely. The balance is important.
Absolutely, because there's the different parenting styles. Authoritative is the best parenting style. Authoritarian, as you mentioned, is all demands, no nurturing. Then you have the submissive and then you have the neglectful side. And we want to be able to provide the balance, which is we demand certain things. We want you to get good grades, but we also love you. We want to make sure that we can help get you to that space too by providing you with love and all of the things that you need. So it can't just be a strict household. It can, but the outcome could result in a child who is moody or has low self esteem, who doesn't know how to navigate the world. They're critical of themselves because the parent was always so critical and didn't show love and they didn't know how to love themselves. And then when you have the parent that is submissive or just enables a situation, you know what that creates an entitled person who doesn't, they're not self aware of what's going on and think that they're invincible, they can do everything. And then the neglectful ones, those are the more challenging cases or can be. So again, it's not cookie cutter because you can have
Mhm.
someone who is from an authoritarian household and they are super successful. It's just the wiring of a person's brain.
Yeah. So it is unique to that individual.
Yes, absolutely.
What would you say the hardest truth is for parents to accept about how their words and actions will affect their child long term?
The truth that we are the cause of our child's issues later on in life. So I feel like it takes a lot for a parent to realize, wow, like the way that I manage, handle, parented my child is a huge or contributing factor to who they are today. I think that's a lot for a parent to accept. With my parents, I try to get them to a space of acknowledging that and apologizing sometimes to their child because that's the first step in healing. How great is it that your parent can apologize to you for the things that may have caused trauma or challenges growing up? It stems
Mhm.
from the foundation, like I mentioned to you. I gave you food. I made sure you had a roof over your head. I gave you everything that you needed. What else do you want from me? You're the adult now. And so it's hard for parents to take accountability for that sometimes. So I don't know if I
Mm,
answered your question, but yeah.
you absolutely did.
Yeah.
And to follow up on that, is that something you see a lot in your work where parents are more prone to be resistant to acknowledging their role in their child's future?
Especially early on in my years of doing this, it was more of what? I did everything. I'm busting my butt. Now you see it more often because more people are in therapy now. More
Mhm.
people are open to getting help and receiving feedback on how things have occurred in their lives. So now people can take accountability. They can apologize for things. They're open to dealing with their traumas and how they've impacted other people in their life, which includes your kids. But in the past, no, it's rough. It's rough.
So destigmatizing therapy has helped some.
Yes, absolutely. I am a huge proponent of therapy. We all can benefit from it. Every single person on this earth
Yeah.
can.
And it doesn't mean something's wrong, right?
Exactly. Exactly.
Yeah. So speaking about the apologies, like you said, you recommend it to all parents. What are some strategies that you feel parents can use to repair the relationships after conflicts or mistakes happen?
One is acknowledgement, apologies, and validation. What I find is a family will come into therapy and a child will open up about how they feel they've been treated. Parents are quick to defend, justify, or shut it down because they are the parent. The first step, in my experience, and even personally, you have to validate and just sit there and just listen.
Mhm.
Listen and validate. That is hard for a lot of moms and dads because, again, there's a perception. What? I
Mhm.
did. So it is listening and validating and giving the child room to finally express themselves. That's the first step. And then it requires more of that, but also then the child has to take accountability for their actions and acknowledgement. And I feel like then the bond can be rebuilt and it can be strengthened and then it can just take off from there.
That validation, listening, not being offensive,
Yeah.
one of the most important things that they can do is listen and validate their experiences.
Yes. Yes. That's what has to happen. Yes. From my perspective. Yes.
Yeah, absolutely. What about the teenage years? How can the parent and the child navigate the boundaries within that time?
Every household is different, and I deal with a lot of different races, ethnic backgrounds, and it just that one is a little tricky, it just depends. Like, when you speak on boundaries, you mean like rules of the household, or are you talking more about feelings, emotions? Like, how would you specify that
Yeah.
question?
So, yeah, the rules change, how much room to grow and make their own decisions, things like that. I imagine it might be difficult to transition from adolescence to teenage where you might have to let up a little bit.
No, and that's actually it. I feel like it's just a matter of what you just mentioned, revamping things. Communication is key. Remember, we spoke on keeping that open forum, that open dialogue going. When a child enters into their pre-teens, they want to do more. So if they want to do more, then the parent would want to sit down and say, okay, hey, you can stay out to this time. In the teenage years, what I've learned, as silly as this may sound, is I believed in contracts. And I actually did it with my own son. We had a contract because I was tired of always fussing and yelling. I was like, this is too much for me. And he's sitting up there just taking it. He's used to it. So I'm like, I got to take the load off of me a little bit. We're going to put this in writing and I'm going to base this off of the things that I know will really hit him, that would really get under his
Mhm.
skin. At that time, he had a car. And I'm like, all right, I know what I'm gonna do. So we put a contract together. We agree on it. He signs it, I signs it, and I have to stick to it. And so it takes away the fussing because now he
Mm,
knows
yeah.
exactly what's going to happen if he doesn't follow these rules, and it makes it easier. And then I'm teaching him about
Mhm.
the democratic way of doing things. Your bosses are not going to yell at you. You're going to sign something, agree to it, try to follow through with it. It's just doing things a little bit differently. That would be a way of trying to steer or go into the direction of transitioning into teen years as they get older. And then when the child goes off to college, when we launch our children off to college, when you come back, we still got the same rules. You can't stay out all night
Mhm.
or drink or curse and all the types of things. But again, for every culture, it's different. For white families, Indian families, Hispanic, it's different. You have to learn the nature or the culture or the family dynamic, right? Then I can help people set those boundaries based on that. Because I'm not the person to tell you how to do what you need to do based off of my experiences or what I think you should do. It's really based on what's operating in your world and how can we make it work for your family.
Yeah, that's a great point. It is different based on cultures and things like that. So it's specific to the household. But one thing to note is that it probably is going to happen where you have to change something
Mm-hmm.
during that.
Oh yeah. When you're dealing with a little, just imagine a little baby. We want the best for a child. Most of us do. But they have their own little minds already, and we're trying to mold it into the right way. I don't know if you know this or not, but between the ages of 0 and 5 are the most impressionable years of any human being's life. And a lot of people don't know that. They think that they could have their child sleeping in the bed with them while
Mm.
another person is in the bed and the child doesn't know. They pick up on all types of things. And then by the time we have until maybe like age 13, and then once they are 13, 14, 15, now they have their own views of the world and others, and it's harder to pull or change a lot of the stuff. So we have to be very mindful of how we parent, what we do, what we introduce our kids to. We want to make sure that we provide them with the right help so that they can excel in life. Catch it early on. In the Black
Yes.
communities, we allow things to fall through the cracks. We don't get our kids the help that they need right away. We pass it off as, oh, that's just okay. But then when you have other cultures, they're on it at age 3, or they're in speech therapy, they're doing this and doing that, they're doing what they need to do. So again, it's about educating, giving people the resources that they need, letting people know what's out there for them.
And so if they know the resources are out there, they know what's out there for them and they choose not to do it for their child, what is that saying about that parent?
That's that parenting style that could be neglectful
Okay.
about themselves. My child is perfect, don't need anything. A lot of parents are in denial. There's nothing wrong with my child, or I don't have time. Yeah, it's a little tricky. Trick bag, as they say.
And I wanted to understand that point because that's a big one. The resources are there. We are destigmatizing mental health. And still, you have some people who refuse to go seek help for them or their children.
Yes. And what is beautiful, but based on the nature of the world right now, for even the lower socioeconomic status individuals or people who don't have a lot, they have the Medicaid or the public aid or public assistance where therapy, your insurance will cover it. So that there's really no excuse. But now, because of the nature of the world, those services may be taken away for the less fortunate. But about maybe 2, 3 years ago, I was like, wow, we take Medicaid, we take public aid, we take all of that now. So there was no excuse. And
Mhm.
so many people were reaching out for therapy services within our culture, the Black communities. I need help with my daughter. I need help with this, help with that. So taking that away is going to be hard to see because finally we get them to a space of knowing therapy is okay. I can help my child or what have you, and then it's going to be taken away.
So when you say that, what is it?
Donald Trump is taking away Medicaid, the low income public aid type thing. He's supposed to be taking it away, or there's going to be stipulations with it.
See, and I think I
Medicare,
heard a little.
yeah, Medicare, stuff like that, or what have you. Again, I don't know the ins and outs of it, but insurance could be affected.
I would say if you still have it right now, you might want to get into some therapy while you.
Absolutely.
All right. So, for adults, we're talking about children, but children become adults.
Mhm.
What advice would you give someone who's trying to rewrite that story of their relationship with their parent as an adult?
So the adult who's trying to rewrite the story with their parent, meaning they want to repair.
They want to repair, maybe tend to some of those wounds that were created during childhood.
One is trying to talk to the parent to see if they can have a back and forth conversation to try to mend or heal. And then, if not, coming into spaces like with me to work through things in a healthy way. That would be a wonderful thing to see more of if we could. What I'm finding is a lot of individuals who come into therapy, there are past rooted pains and traumas and things that haven't been resolved or worked through. I'm a firm believer we are who we are because of our upbringing, whether that's within the home or outside of the home. And so, if you are truly working on yourself, we got to address that stuff. And if your parents are involved in those traumas or things that hurt us, we need to resolve those unresolved issues. That might look like someone who comes into therapy and they're realizing, like, wow, I didn't realize that my mom was so anxious all the time. She always kept me on edge, or she was always sad, or my parents were always fighting. Now that adult child wants to express to the parent how they were made to feel. What we would hope is that parent would be in a space of, you know what, I'm sorry, I dreaded having this talk with you, but I'm glad you're bringing it up. If it doesn't work that way, then there are other ways, like bringing the parent into the therapy space. If that doesn't happen, there's something called the empty chair technique. The empty chair technique is a space for a patient to talk directly to this empty chair as if that is the person who is no longer here, not available to process the steps. A therapist takes on the role to allow that person to work through their pain or traumas.
Yeah. Have you seen a good bit of success with the empty chair?
I have. And it happens with individuals who have lost loved ones. The parent or loved one is no longer here, and there's a lot of regret. They didn't get to say or get to resolve what it is. It really helps.
Okay. I've heard a lot about it, and I was always curious to know how it was received by clients.
Yeah, yeah, yeah. You have to know the patient, the client before you. Nothing is cookie cutter. So there's so many different theoretical approaches. If it's suited for the person, it definitely can work.
Yeah, knowing who it's suited for is a big part of it.
Yeah.
Yeah.
It's somebody like, I'm not talking to no, well, this
Yeah.
person's not even here. Are you serious right now? Then you got some
Yeah.
people, they just feel it. They're all into it. They can do it. So yeah.
All right, so we're gonna move on to discipline because we can't
Oh,
talk about parenting without
hey,
discipline.
yes. Wow. Mhm.
Dr. Downey, what is the difference between discipline and punishment?
Discipline would be more the consequences are set. I'm going to
Okay.
talk to you and let you know, maybe in advance or at the time, this is what's about to happen. If
Yeah.
you come in late past the curfew time, I'm going to discipline you in a way where you hopefully understand it and won't do it again. There may be consequences. You can't drive your car for some days, you can't use your cell phone. And then I'm going to talk to you about why it's important for you to come in on time and disciplining. Punishment, from my perspective, is punitive, like putting down, doing things. It could be in the form of abuse, whether it's verbal or
Mhm.
physical, punishing, making a person feel bad about something they have done wrong. Discipline,
Mm,
punishment is up for debate. Other
mhm.
therapists might disagree, but that's my perspective.
Discipline is more of a teaching opportunity.
Yes.
And
Think
mm,
about the definition of discipline. When we're disciplining ourselves, what does that mean? Like when we have a project that's due and I have to discipline myself, which means I have to get regimented, I have to do the things and stay on this course to get to this ultimate goal, right? I'm not punishing myself though. I'm just
right.
disciplined in a way. Punishment though, if I punish myself, I'm gonna talk bad about myself, not give myself grace. So that's how I look at it. Yeah.
Yeah, that makes sense to me.
Hmm.
Yeah, because it doesn't sound like there's a real clear distinction. So
Yeah.
you just gave me one.
Good.
All right. So what's a healthier alternative?
That's a tough one. You got a child that's a knucklehead. I wish I knew what I know now. What I will say is walking away. because you want the best for your child.
Mm.
When they do stuff that you know is not okay, the best thing when you get angry is to walk away. Give yourself a moment to calm down because, again, the child, whether it's a teenager, middle school, or look, they're not going to hear you if you're coming in their anger. All you're going to do is just create a sense of fear.
Mhm.
They're going to shut down and be scared to open up to you. So, finding a way to compose yourself and coming back, you can still be stern and get your point across. If you're angry, you'll lose the child in that way. This is hard. Trust me, it's very hard to do because we are flawed individuals. If you do get angry, apologize. Come back and apologize. Use the space as a learning lesson. You can always come back from it. It's just when you get angry, you lose it and you don't do nothing after that. And the child is just left
Mm.
to feel what they're feeling. They remember that stuff. And if it happens more than once, it can be detrimental in the long run.
Allow yourself as a parent to make those mistakes, to have those human moments of anger and frustration, but don't leave it there.
Mhm.
Acknowledge
Mhm.
that it could have been handled better.
Yeah, definitely. And also, if you know that your child, your teen skipped school all week and got D's and F's and they've been lying to your face, right? And you have all this information, you might need to go for a run first before you get to the child, right? So you are in control of managing yourself, meaning you need to know yourself well enough to know what to do next. If you are quick to go off, have a temper and things like that, I would never advise you to just go straight in. Take care of yourself first, disciplinary talk with the child. But again, you have to know who you are as a person on how you want to manage those situations or navigate those spaces.
That self awareness is important.
Yeah,
Okay.
absolutely.
All right. So let's get to, we're still on discipline here, going back over to adulthood.
Okay.
A lot of adults still remember how they were disciplined, how they were punished, or however they grew up. In your experience, how do those early years shape the way they now parent their own children?
It shapes it a lot. And what I mean by that is there are some individuals who have been in very abusive, they grew up just abused, they've witnessed so much. And they tell themselves they will not be that same parent. And I've seen that they're adamant about not being that same parent. And it's a wonderful thing to see. And I feel like it's even better if they've worked on themselves. Oftentimes, I have found that the way we are parented, the way that we grew up, what we see, we tend to repeat. It's learned behavior, right? It can be from as simple as having a messy house and as an adult having a messy house. It can be growing up in a household where all you did was yell, and then you get with someone who is not a yeller and you start yelling, and the person is just, wait, what? Abuse? It's learned behavior oftentimes. So you have to make sure before you enter into relationships with other people, you have to make sure that you have checked in with yourself and done the work on yourself. Be self aware enough to know, okay, I need help. I need to make some changes for the betterment of the relationship that you're in. And that could be with friendships, with your own kids, work relationships, romantic relationships. We're in relation with people all the time. So, yes, your early years definitely shape who we become today. And I would just hope that people will be willing to work on themselves if it's not how you want it to be. Lastly, there are individuals who feel there is nothing wrong with them and they will keep on being who they are and who they are becoming and where they're going and will not blink an eye to want to change or anything.
And there's really not much you can do with
Mm-mm.
that attitude,
Nope, nothing.
mindset.
Nope, can't force anyone to do something. They have to want it themselves. So, yeah. The great thing about therapy, and over the years, I guess increased during the pandemic, business was amazing because people were going through something they had never experienced before. Since then, more men, more Black people, more Hispanic people, they're coming into the therapy space, which means that they're ready,
Hmm.
which is a beautiful thing to make the call and say, hey, I need to work on this. You would be amazed with how many emails or calls I get, and people are just, they don't even know me yet. And they're saying, I need to work on, I'm ready. I was referred to you, and it's a good thing. I hate that people probably went through something to get there, whether somebody told you like, "Oh, I need to work on this," whatever, or but they come in and they're ready. I know there's a handful of people who are just like, there's nothing wrong with me.
Yeah, but maybe it's not their time. Maybe the next wave includes those people.
Yep, exactly.
Yeah. So we're at the end here, and I just want to ask the wrap up question.
Yes.
We're talking about parenting and children and their emotions and their relationships. Yeah. If every parent, just you know how it is to be that parent, you told me is so tough. So if every parent, in your opinion, could hear an unfiltered message from their child, what would that message be?
Can you please be quiet and just listen to me? What I say matters. You don't know how I feel.
Wow.
Yep.
That's beautiful. That's at the core of what I feel every child is saying.
Yep.
It's how I felt. I know that throughout life, that's going to be something that sticks with all of us is just wanting to be heard.
Yep.
And seen.
Yeah. It's so important. I worked early in my career at a middle school, predominantly white, and I was blown away with how many kids were suffering inside and didn't have a voice and didn't know how to articulate how they felt about things. These kids were cutting and they weren't even true cutters. They were mimicking what they saw or how mean kids were to other people. And I'm like, what is going on? But it's a real thing. Oftentimes it stems from the household. They come to school and they're projecting. It's unfortunate. It hurt my heart because I'm like, wow. And so you want to just, or at least for me, I wanted to be a space for these young kids to open up and be able to listen to what they had to say because they don't know any better. So to say to a parent, just listen to me because you don't know how they feel. A lot of parents don't have the tools to sit, listen, and validate. So I learned that very early on in my career, and it continues on. When children come into therapy, to meet with us as early as age 3. We give them a safe space. It's so important to provide that space. If anything, when you come see Dr. Downey, you're going to have a space to play and just be you and be free. And that I think is really important. And if anything, they'll remember when I went to Dr. Keisha, I got to do this, I got to do that, or whatever. We want the experience to be right because they may not be getting that at home. And again, parents work, they're busting their butts. They love their kids. They don't mean to leave their kids at home or with other people because they're trying to provide. And I don't knock that at all because that was me working a lot, trying to do what I can to support my kids. But the child they need a space. They need to know it's okay to speak up and voice. Otherwise, they will numb and find things to numb themselves, maybe get into trouble, do things that we don't want them to do.
Yeah, it was a good one. All of it's true. And it's just, you just gave a little bit more depth to it.
Yeah.
So I just want to thank you for everything today, for being here.
You are welcome. I'm so happy to be here. I love to contribute when I can, whatever knowledge I can give. I love doing this. So thank you for having me.
Hopefully I can have you back on in the future too.
Absolutely. I'm here.
All right. Well, take care. Enjoy the rest of your day.
You have a great rest of your week.
Bye-bye.